Good morning, classmate. Good morning, Mariam. I'm here to discuss one of psychobiological disorder named schizophrenia. Schizophrenia derived from the Greek words "schizan" to split and "phren" meaning mind. It's a complex and heterogeneous disorder involves losing touch with reality, leading to significant distress and impairment in various aspects of life. Features of schizophrenia including delusions, this is a false beliefs that are not based in reality. Hallucinations, seeing or hearing things that are not present. Grossly disorganized or abnormal motor behaviors can range from childlike silliness to unpredictable agitation. Disorganized thinking, it is incoherent and irrelevant speech patterns. And negative symptoms include reduced emotions expression, lack of motivation, and social withdrawal. According to studies, the chances of having or developing schizophrenia influenced by genetics relationship. As you can see, chances of developing disorder in first degree relative of person with schizophrenia who shares about 50% of genes, in niece and nephew who shares about 25% of genes, and general population of about 1 to 2% chances. Having a biological relative with schizophrenia increases the risk but does not guarantee the development of disorder, such as the genes play a role of the risk of developing schizophrenia. According to adoption studies, a child of a person with schizophrenia may develop the disorder due to environmental factors rather than genetics. The stressful home environment may expose the child to illogical thoughts, mood swings, and chaotic behavior, and negative symptoms schizophrenia may affect the child's skills. In in Pecatianari adoption study found that 10% of adoptees with biological mothers who have schizophrenia develop schizophrenia or another psychotic disorder. In twin studies, monozygotic twins have greater risk of schizophrenia than dizygotic twins. This suggests a strong genetic component to the disorder as monozygotic twins share 100% of their genes while dizygotic twins share about 50%. According to neurodevelopment hypothesis, suggests that schizophrenia is a disorder that originates during the developmental years or adolescence of early adulthood. This theory proposed that alterations in the genetic control of brain maturations during the critical periods lead to the onset of schizophrenia. And when it comes to birth complications such as longitudinal study indicates that individuals that experience obstetric difficulties, complications during birth are more likely to develop schizophrenia. And in prenatal viral exposure, studies shown that higher rates of schizophrenia among individuals whose mothers were exposed to viral infections. This is the structural abnormalities in the brain of a individual with schizophrenia. In part of the ventricles, enlarged ventricles are one of the most consistent findings in neuroimaging studies. In frontal lobe, the abnormalities of the brain is decreased. And in prefrontal cortex shows that cortical atrophy or pronounced thinning, reduced gray matter, low neural activity. In dorsolateral prefrontal cells, there's a fewer synapses. The synapses are the connections between neurons that allow them to communicate with each other. And in temporal cortex, the abnormality decreases the gray matter. This gray matter consists of neuronal cell bodies, dendrites, and synapses. The reduction in the gray matter in the temporal cortex can lead to impairment in auditory processing, which might contribute to some of the symptoms of having schizophrenia. In parts of superior and middle temporal gyri, as you can see, the abnormality is smaller size. And in amygdala and hippocampus, of the abnormality, smaller size, haphazard orientation of pyramidal neurons in the hippocampus. The structural in the part of amygdala and hippocampus contribute to the cognitive and emotional symptoms observed in schizophrenia. This is also the structures of abnormalities in part of the brains also. The thalamus and parietal, basal ganglia, corpus callosum, Broca's area, and anterior cingulate cortex. The abnormality of that is smaller size and lack of asymmetry. In neurotransmitter, there is excessive activity level that can lead to overstimulation of certain brain pathways, which may result in distorted perceptions and thoughts, characteristic of schizophrenia. In part of serotonin, in the context of schizophrenia, there is a dysregulation of dopamine neurons in the mesolimbic pathway. In gamma aminobutyric acid, there is also an abnormality of reduced GABA synthesis. Same with the glutamate glue. There's also a decrease in inputs from either the prefrontal cortex of the hippocampus to the corpus. Patient profile name John Ferrer. He's 20 years old, male, Canadian or mixed cultural heritage. His patient details initially in the university and currently at his mother's home. He was diagnosed with schizophrenia within the past year, second psychotic within a year, and a history of bizarre behavior, aloofness, and withdrawal. Comorbidities is not mentioned. His existing social support, strong support from his mother, best friend Mark, who has known him since high school and remained concerned from his well-being. Limited interaction with others, spend more time in isolation or occasional visits with Mark. Nursing process, one of the therapeutic communication that we can use is empathy. This is involved by understanding and sharing the feelings of another person. For example, it sounds like you're going through a lot of time. Can you share more about what you're feeling right now? This helps John feels heard and understood, which can be very comforting and validating. Number two, collaboration. These skills focus on working together with the person to find solutions. For example, let's work together to find a plan that makes you feel comfortable and supported. What do you think could help you the most? This approach empowers John by involving him in the decision making process, making him feel more in control and supported. Nursing diagnosis of a patient with schizophrenia. Number one, impaired social interaction related to delusional thinking as evidenced by withdrawal from social activities and relationship. One of the treatment goals is patient can able to engage at least one social activity per week within the next month. This is the measurable achievable goal that aims to improve the patient's social interaction. Nursing intervention encourage participation in a weekly support group or community activity to foster social interaction. Our evaluation is to monitor patients' participation in social activities and note any improvements in social interaction. The outcome desired for the patient is to report feeling more connected to others and show increased social engagement. We also have a consideration of the patient developmental level as a young adult and his needs are for independence. Nursing diagnosis number two is disturbed thought processes related to psychotic episodes as evidenced by bizarre behavior and disorganized speech. Our treatment goals in here is patient can demonstrate improved thoughts, organization, and reduce instances of bizarre behavior over the next 4 hours. Nursing intervention is to implement a structured daily routine and cognitive behavior therapy sessions to improve thought processes, like cognitive behavioral therapy. The cognitive behavioral therapy session aims to improve thought processes by helping the patient recognize and change negative thought patterns and behaviors. Evaluation is to assess the patient's thought organization and frequency of bizarre behavior during therapy sessions. This involves regular check in and observations to determine if there are improvements in their cognitive function. Consideration is acknowledged as cultural and involvement is family personal preferences. Pharmacological intervention. One of the psychotic medication is risperidone or Risperdal is an antipsychotic medication commonly used to treat schizophrenia. It helps manage symptoms such as hallucination, delusions, and disorganized thinking by affecting the levels of neurotransmitter, particularly dopamine and serotonin in the brain. Patient teaching for risperidone is medical adherence. Explain the importance of taking risperidone exactly as prescribed, even if the patient feels better to improve relapse of symptoms. We also need to teach the patient about the side effects of the medications such as drowsiness, dizziness, weight gain, and increased appetite. Lifestyle recommendation. We encourage the patient to eat balanced diet and exercise to manage potential weight gain and metabolic changes associated with risperidone. About the drug interaction, we urge the patient to inform all healthcare providers about taking risperidone, including the over-the-counter medications and supplements to avoid potential drug interactions. Number 5 is we follow up appointments to emphasize the importance of regular appointments to monitor medication effectiveness and adjustment. Drug interactions, we provide clear instructions on what to do if a dose missed, typically advising to take it as soon as remembered unless it's close to the next door. Never double dose to catch up. Missed dose, provide clear instructions on what to do if dose is missed. Number 7, caution the patient about operating heavy machinery until they know how risperidone affects them. These are the patient resources that can help for a patient with schizophrenia. Number 1 is BC Schizophrenia Society. This organization provides support and resources to individuals and families affected by schizophrenia. They offer educational programs, support groups, or advocacy. Number 2 is Canadian Mental Health Association. This is promoting mental health and supporting individuals with mental health challenges. And they also provide a range of services, including the mental health education, support program, and advocacy. And number 3 is BC Partners for Mental Health and Addiction Information. This is a collaboration of 7 leading mental health and addictions nonprofit agencies in British Columbia. And regarding to other patient resources, you can also have a support with 1-800 suicide. This is a confidential crisis hotline specifically for individuals who are feeling suicidal or for those who know someone who might be experiencing suicidal thoughts. This service is available 24 hours on 7 days a week. And number 2 is 211 British Columbia offers a free, confidential, and multilingual helpline that connects people to essential resources, including mental health support. It operates 24 hours a day, 7 days a week, providing continuous access to vital assistance and information. Both services are designed to provide immediate support to patients having schizophrenia. And this is all my references about my report. Thank you for listening.